Hi, Dr. Flamm. Thank you for joining us on MD Newsline. And I know we've talked about this before, but can you tell us what MASH is?
Yeah, that's an excellent question because one of the big problems in the United States and around the world is a problem that, in my world, as a liver doctor, a hepatologist, we call fatty liver or MASLD. That stands for Metabolic Associated Steatotic Liver Disease. A normal liver doesn't have any fat or virtually no fat. But it turns out that approximately 30% of the entire United States population, or 100 million people, have fat in their liver where it doesn't belong. And again, we call that MASLD. Now, a fraction of those patients, and we don't understand why, get inflammatory cells in the liver. These inflammatory cells in your body go into the liver when there's fat there and attack and create true damage in the liver. That problem is called MASH. Now, it turns out that about 25% of the people that have fatty liver or MASLD have MASH. 25%. Now, you can only determine if someone has MASH if you do a liver biopsy, which we usually do not do, but it's still very important because it turns out that the patients with this hepatitis, with these inflammatory cells in the liver, MASH, they are the ones that are at risk for true damage to the liver, which we call fibrosis. Those are the patients, if they get more and more fibrosis over time, can get cirrhosis, get complications of cirrhosis, and die from liver disease. So this is a very common problem. Only a fraction of the patients get this hepatitis. Only a fraction of patients develop cirrhosis, but it's still a significant number of people in the United States. And by the way, if you said, how do you even know if you have fatty liver? It's so many people. You can see it on imaging. If anybody gets an ultrasound or a CT scan or an MRI that includes the liver, you can see the changes that we call steatosis, which is the medical word for fat.
So that's a lot of people with fat on their liver. How do some people develop fat on their liver and some people don't? What makes people susceptible to that?
That also is a great question. We're working on that in the clinical research world every day. And we have been, I would say, that for the past 20 to 30 years since this liver problem became apparent. And we don't know all the answers. We do know that fatty liver is almost always associated with at least one of three conditions. People have high cholesterol and or triglycerides. People have type 2 diabetes mellitus, or people are overweight. And it turns out many of the patients with this have all three of them. So we know clinical conditions that lead to the development of this fatty liver. Exactly how it happens, we don't know. We know that insulin resistance, which is what we see with type 2 diabetes mellitus, by the way, is one of the big drivers of developing fat in the liver or steatosis. We know, although we don't have it well characterized yet, that genetic factors almost certainly play a role, and the medical community is working very hard to try to ascertain what genetic factors seem to contribute to the development of fatty liver in the first place, and then the development of the steatohepatitis in the fraction of people that get it in the second place, and then developing liver fibrosis, damage in the liver, in the third place. But we don't yet have a very good characterization of the genetic underpinnings yet of all of these different factors that lead to progressive liver disease from fatty liver.